Dr. Gabrielle Lyon emphasizes that muscle is the organ of longevity, playing a crucial role in glucose disposal, amino acid storage, and overall metabolic health. She explains that many metabolic diseases begin in skeletal muscle decades before symptoms appear. Dr. Lyon came to this understanding through her work in geriatrics, where she observed that patients who followed conventional dietary advice often had unhealthy metabolic profiles. She realized that the issue wasn't just excess fat, but insufficient muscle mass. Dr. Lyon distinguishes between muscle health and muscle size, noting that it's possible to have a lot of muscle with poor health or a moderate amount of muscle with good health. She explains that unhealthy muscle can have fat infiltration, similar to marbling in steak, which affects its ability to contract and function efficiently. The focus should be on muscle quality rather than just quantity. Dr. Lyon emphasizes the importance of dietary protein for muscle health. She recommends aiming for 1 gram of protein per pound of ideal body weight distributed throughout the day. The first meal of the day is particularly important for setting up metabolic health. She suggests consuming 30 to 50 grams of high-quality protein at this meal to stimulate muscle protein synthesis and improve satiety. The quality of protein matters, with animal-based proteins generally having a more complete amino acid profile. However, plant-based proteins can be sufficient if consumed in higher quantities. Dr. Lyon notes that the current recommended daily allowance, RDA, for protein is likely too low for optimal health, especially for older adults. Resistance training is crucial for maintaining and improving muscle health. Dr. Lyon recommends at least 2 to 3 days of resistance training per week, focusing on compound movements that engage multiple muscle groups. For beginners or those with limited mobility, she suggests starting with bodyweight exercises or using resistance bands before progressing to weights. High-intensity interval training, HIT, is also beneficial as it can improve cardiovascular health and muscle function in a time-efficient manner. Dr. Lyon prefers HIT over steady-state cardio for its metabolic benefits. Dr. Lyon stresses that sedentary behavior is a disease state in itself. She notes that the majority of Americans don't meet the minimum physical activity guidelines, which include 150 minutes of moderate to vigorous activity per week and 2 days of resistance training. Regular movement throughout the day, beyond structured exercise, is crucial for overall health. As we age, maintaining muscle health becomes increasingly important. Dr. Lyon explains that older adults may need more protein to stimulate muscle protein synthesis, potentially up to 40 to 50 grams per meal. She also notes that the efficiency of muscle protein synthesis declines with age, making both proper nutrition and resistance training even more critical. Dr. Lyon recommends several supplements for supporting muscle health. 1. Creatine monohydrate, beneficial for muscle strength and potentially brain health. 2. Urolithin a postbiotic that may improve mitochondrial health and muscle function. 3. Whey protein, an easily digestible source of high-quality protein. 4. Collagen, while not directly beneficial for muscle, it may support tendon and joint health. 5. Fish oil, may have anabolic effects and support overall health. She also mentions that magnesium supplementation can be beneficial, as many people may be deficient due to soil depletion. Dr. Lyon discusses the pros and cons of intermittent fasting. While it can provide benefits such as calorie restriction and bowel rest, she cautions that it may not be ideal for older individuals or those struggling to maintain muscle mass. She suggests that if fasting is practiced, it's important to ensure adequate protein intake during eating windows. Dr. Lyon emphasizes the importance of mindset in achieving and maintaining health. She suggests focusing on setting standards rather than goals, as standards provide a consistent framework for behavior. Understanding personal vulnerabilities and maintaining emotional neutrality can help prevent setbacks in health and fitness journeys. Importantly, Dr. Lyon notes that people will only be as healthy as they feel worthy of being. Addressing feelings of unworthiness or beliefs that self-care is selfish is crucial for long-term health success. Dr. Lyon explains that muscle is a nutrient-sensing organ, particularly sensitive to the amino acid leucine. Consuming adequate leucine, found in high-quality proteins, stimulates muscle protein synthesis. She notes that the amount of protein needed to stimulate muscle protein synthesis is similar to the amount that triggers the release of satiety hormones like GLP-1. Healthy muscle tissue plays a crucial role in glucose disposal and insulin sensitivity. Dr. Lyon explains that exercise, particularly resistance training, increases the density of GLUT4 receptors on muscle cells, allowing for more efficient glucose uptake. This mechanism is key in preventing and managing conditions like type 2 diabetes and obesity. Dr. Lyon discusses the connection between muscle health and brain health. Exercise, particularly resistance training, triggers the release of myokines from muscle tissue. These myokines can stimulate the production of BDNF, brain-derived neurotrophic factor, in the brain, supporting neuroplasticity and potentially reducing the risk of cognitive decline. Healthy muscle tissue also plays a role in immune function. Dr. Lyon explains that myokines released during muscle contraction can interact with immune cells, potentially dampening inflammatory responses and supporting overall immune health. Dr. Lyon provides practical advice for optimizing nutrition for muscle health. She suggests prioritizing protein intake, aiming for 30 to 50 grams of high-quality protein per meal. Carbohydrate intake should be based on activity level, with a general recommendation of around 130 grams per day for sedentary individuals. Fat intake can be adjusted based on individual needs and preferences. For resistance training, Dr. Lyon recommends focusing on compound movements that engage multiple muscle groups. She suggests using machines or supported exercises for beginners or those with limited mobility, as these high-ground movements allow for proper form and reduce injury risk. The goal should be to challenge the muscles sufficiently to stimulate adaptation and growth. Dr. Lyon discusses various supplements that can support muscle health, including creatine, urolithin A, and fish oil. She also cautions about certain medications that can negatively impact muscle health, such as statins, NSAIDs in high doses, and some antibiotics. Dr. Lyon provides a balanced perspective on GLP-1 agonists like Ozempic and Mounjaro. While acknowledging their effectiveness for weight loss, she emphasizes the importance of combining these medications with proper nutrition and exercise to maintain muscle mass. She notes that when used under medical supervision and in conjunction with lifestyle changes, these medications can be transformative for some individuals struggling with obesity. Dr. Lyon stresses the importance of mindset in achieving and maintaining health. She recommends 1. Setting standards rather than goals. 2. Understanding personal vulnerabilities. 3. Maintaining emotional neutrality. 4. Addressing feelings of worthiness. She explains that these mindset shifts can help individuals maintain consistent health behaviors over the long term. Throughout the podcast, Dr. Lyon emphasizes that muscle health is fundamental to overall health and longevity. By focusing on proper nutrition, regular resistance training, and maintaining a healthy mindset, individuals can support their muscle health and potentially improve their health span and lifespan. She encourages listeners to view muscle not just in terms of aesthetics or strength, but as a crucial organ system that influences metabolic health, brain function, and overall well-being.